You are the front line of infection prevention within your healthcare facility every day. By maintaining a clean and sanitary environment, you play an essential role in safeguarding patients, visitors, and staff from infection, all the while working in a fast-paced, cost-conscious environment, juggling many tasks at once with rapid turnover, and many patients with different diagnoses and care needs. The environment is a primary and often unexpected source of microorganisms that lead to infection that compromises care. Healthcare-associated infections, or HAIs, are considered an undesirable outcome that may dramatically increase cost of hospital stay, result in excess deaths, and can also result in Affordable Care Act penalties for your facility. These infections can also be an indicator of quality of patient care. For these reasons, HAIs have become a significant part of the patient safety agenda. PDI, a company dedicated to developing the most advanced line of one-step infection prevention solutions, wants to be a valued partner in helping you protect patients with our environment of care solutions, including Sani-Cloth, the #1 brand of surface disinfectants in healthcare. This video about Super Sani-Cloth germicidal disposable wipes is intended to support you in maintaining clinically effective protocols, provide ongoing training and support, and elevate your infection-fighting arsenal with ready-to-use disinfectants with advanced technology, all to help you disinfect effectively, efficiently, and with confidence. This video should be used as additional support with your facility's existing ES practices. You should always refer to your facility's policies and protocols. It's important to remember that while keeping your healthcare facility clean and safe is a top priority, another valued part of your job is interacting with the people you serve. Demonstrating care and concern with patients and their families will only add to positive, memorable experiences and help make them feel safer, less anxious, and well cared for, not to mention contributing to better HCAHPS cleanliness scores and elevating the reputation of your facility within the community. In this video, we will show you proven steps and practices for effectively and efficiently cleaning and disinfecting surfaces in rooms for daily cleaning. Studies have indicated that if an infected patient's room is not cleaned properly, their roommates and subsequent occupants have an increased risk of being infected with the same microorganism. One study has shown that the risk of acquiring C. difficile from the room of a previously infected occupant may be as high as 235% for the next occupant. For maximum efficiency when entering an occupied room, determine a clockwise or counterclockwise flow based on the layout of the room and where patients and visitors may be located. Always clean the bathroom last. Identify common high-touch surfaces in the room, areas where patients, visitors, and healthcare professionals come into frequent contact. In addition, identify patient care equipment in the room and follow your facility's protocol for cleaning when in use. Depending on the equipment and your facility's protocol, cleaning the equipment surfaces may be designated to nursing, respiratory care, or other care specialists. Super Sani-Cloth germicidal disposable wipes are an ideal product for addressing high-touch surfaces and are ideal for daily use in fast-paced environments. They are effective against enveloped and non-enveloped viruses, bacteria, TB, pathogenic fungi, multi-drug-resistant organisms, and blood-borne pathogens. They kill 30 microorganisms and disinfect in 2 minutes to give you confidence that you're safeguarding against these microorganisms. With Super Sani-Cloth germicidal disposable wipes, there's no need to mix or measure. The pre-saturated wipes have the proper amounts of germicidal solutions, saving you valuable time and assuring the proper use dilution and efficacy per the label without having to mix. Be sure to wear gloves and other personal protective equipment as appropriate. Cover the opening halfway with one hand. Remove wipe with a uniform pull away from face and eyes. When not in use, keep lid closed to prevent moisture loss. To effectively disinfect high-touch surfaces, there should be no visible soil on the surface. If there is visible soil, clean first to remove all organic matter, dust, dirt, blood, or other organic material, so the disinfectant can decontaminate the surface. Make sure all of the soil is removed, using more wipes if necessary. This step is required only if heavy soil is present. You don't need to wait the contact time for this cleaning step. Now, using a clean wipe, thoroughly wipe the high-touch surface, getting into crevices and corners. If the wipe is not saturated enough to wet the surface, discard and use a new wipe. Allow treated surface to remain wet for the full 2 minutes. Thoroughly wipe bed and handrails, TV remote, call button, and cords, bedside table handles, telephone, light switches, door handles, as well as furniture, especially chairs. Bathrooms are typically the dirtiest part of a patient room and should be cleaned last. Identify high-touch areas within the bathroom for wiping, which include, but are not limited to, the sink, shower, and toilet areas. Clean the bathroom from the top to the bottom. Wipe these areas thoroughly with Super Sani-Cloth germicidal disposable wipes, adhering to the recommended contact time. We appreciate the pressures that exist for you today when safeguarding the patient environment. That's why PDI is committed to partnering with ES teams like yours with ongoing training and support like this video, and providing products for your infection-fighting arsenal with ready-to-use disinfectants and advanced technologies so that you can deliver the best inpatient care. Our infection prevention products are designed to help you be the difference in improving patient outcomes and reducing costs. Because after all, a healing environment begins with a safe environment.